Strokes occur as a result of either obstruction or bleeding. With obstruction, atherosclerosis has caused fatty deposits to accumulate in the walls of blood vessels feeding the brain. When small particles from these deposits break loose and travel, they can interfere with blood flow to the brain, resulting in a stroke. These fatty deposits can cause two types of obstruction. The first is a cerebral thrombosis. This happens when a blood clot travels through the blood vessel, becomes lodged, and then creates an obstruction cutting off blood flow to the brain. The second obstruction is referred to as a cerebral embolism. This occurs as a result of a clot that has formed in another area of the body, for example, the heart or carotid arteries. When pieces of these clots break loose, they can travel through the bloodstream. When these pieces reach the smaller blood vessels near the brain, they are too large to pass and cause an obstruction. A hemorrhagic stroke occurs when a weak blood vessel in the brain ruptures and bleeds. This puts pressure on the tissue near the brain. There are two types of hemorrhagic strokes, intracerebral and subarachnoid. Weakened blood vessels in the brain are generally caused by an aneurysm or malformation. An aneurysm is a bulging of a vessel as a result of pressure. This can happen as a result of blood vessel disorders, infection, trauma, and even drug use. An arteriovenous malformation can create a miscommunication between the arteries and veins, causing blood from the arteries to enter the veins.